नमस्ते नमस्कार म सञ्जिता पण्डित वेलकम गर्दिछु यहाँहरूलाई मेडिकल विथ सन्जुमा। आज म धेरै दिनपछि यहाँहरूको सामु उपस्थित भएको छु नयाँ सेट लिएर नेपाल नर्सिङ काउन्सिल बेस्ड मोडल एक्जाम सेट 20A। सो यहाँहरूलाई थाहा होला यो एक्जाममा फुल मार्क 150 र ड्युरेसन भनेको 2.5 आवरको हुन्छ, जसमा 150 मल्टिपल चोइस क्वेसन हुन्छ र अप्सन 4 दिएको हुन्छ त्यसमा र मोस्ट प्रोबेबल वानमा चाहिँ टिक लगाउनु पर्ने हुन्छ। यो एक्जाममा मोबाइल र क्याल्कुलेटर्स आर स्ट्रिक्टली प्रोहिबिटेड। सो स्टार्ट गरौँ आजको सेट। क्वेसन नम्बर 1, द नर्स शुड इन्क्लुड व्हिच अफ द फलोइङ क्लाइन्ट टिचिङ फर द प्रिभेन्सन अफ ऱ्यापिड प्रोग्रेस अफ ओस्टियोपोरोसिस। द्याट मिन्स नर्सले कुन किसिमको चाहिँ टिचिङ दिन्छ एउटा पेसेन्टलाई, ओस्टियोपोरोसिस भएको पेसेन्टलाई कि ऱ्यापिड प्रोग्रेस हुनलाई, त्यो डिजिजबाट बच्नलाई, प्रिभेन्सन हुनलाई। अप्सन ए, एभोइडिङ टेकिङ मिल्क। अप्सन बी, एभोइड टेकिङ प्रोटिन रिच फुड्स। अप्सन सी, एभोइड क्याल्सियम सप्लिमेन्ट एन्ड अप्सन डी, एभोइड अल्कोहल। फर्स्ट अफ अल ओस्टियोपोरोसिस हो के? ओस्टियोपोरोसिस कतिखेर डेभलप हुन्छ? When bones is broken down then replaced। यो पिक्चरमा चाहिँ यहाँहरूले हेर्न सक्नुहुन्छ नर्मल बोन र ओस्टियोपोरोसिस बोनको चाहिँ बीचमा डिफरेन्स चाहिँ छुट्याउन सक्नुहुन्छ है। र मेन कज हुन्छ ओस्टियोपोरोसिसको त्यो भनेको चाहिँ ल्याक अफ क्याल्सियम। सो द राइट आन्सर इज अप्सन डी, एभोइड अल्कोहल। Question number 2, a spice cast was put on a baby Betty after an unfortunate incident to immobilize her hips and thighs. Which of the following is the priority nursing action immediately after the applications? क्वेशनले के भनेको छ, एउटा दुर्घटना भएको थियो बच्चासँग है, अनि त्यो दुर्घटनामा चाहिँ बेबीको हिप र थाई चाहिँ स्थिर राख्न डिफिकल्ट भयो र त्यसलाई चाहिँ स्थिर राख्नको लागि, इमोबिलाइज गर्नको लागि चाहिँ एउटा स्पाइस कास्ट लगायो। त्यो चाहिँ टाइममा कस्तो चाहिँ इमिडिएटली केयर दिनुपर्छ, कुन प्रायोरिटी चाहिँ राख्नुपर्छ? अप्सन ए, कीप द कास्ट ड्राई एन्ड क्लीन। अप्सन बी, कभर द पेरिनियल एरिया। अप्सन सी, एलिभेट द कास्ट एन्ड अप्सन डी, परफर्म न्यूरोभास्कुलर चेक्स। यसको आन्सर हुन्छ अप्सन डी, perform neurovascular checks. Question number 3, for the patient of intestinal obstruction, everything except ... should be done. Option A, anti-decompression. Option B, aerial hydration. Option C, prophylactic antibiotic. And option D, oral feeding. यसको राइट आन्सर हुन्छ अप्सन सी, prophylactic antibiotic. Question number 4, benzodiazepine poisoning should be treated with. Option A, atropine. Option B, flumazenil. Option C, naloxone. Option D, charcoal. यसको राइट आन्सर हुन्छ अप्सन बी। Question number 5, antidote of atropine is. Option A, protamine sulfate. Option B, charcoal. Option C, naloxone. And option D, vitamin K. यो क्वेशनहरुको चाहिँ म डिस्क्राइब गरिरहेको छुइन, किनभने यो भन्दा पहिलाको सेटहरुमा चाहिँ यो क्वेशन्सहरु आइसकेको छ र डिस्क्रिप्सन्स पनि भइसकेको छ। यसको राइट आन्सर हुन्छ द एन्टिडोट अफ एट्रोपिन इज प्रोटामाइन सल्फेट। क्वेशन नम्बर 6, ब्रेन ड्यामेज अकर्स विदिन। अप्सन ए 10 मिनट्स, अप्सन बी 2 मिनट्स, अप्सन सी 4 मिनट्स एन्ड अप्सन डी 6 मिनट्स। Answer option C, 4 minutes. Question number 7, furosemide is a drug used to. Option A, purgative edema. Option B, cleansing edema. Option C, both. And option D, antihelminthic. The right answer is option C, both. Purgative edema and cleansing edema दुईटैमा दिन्छ। खास गरी फ्युरोसेमाइड भनेको चाहिँ जब हाम्रो बडीमा फ्लुइडको कलेक्सन्स धेरै हुन्छ, इडिमा हुन्छ, त्यो चाहिँ केसमा दिन्छ। क्वेशन नम्बर 8, फ्युरोसेमाइड इज अ ड्रग युज्ड टु। अप्सन ए, डिक्रिज युरिन आउटपुट। Option B, increase blood volume. Option C, decrease blood volume. And option D, increase blood pressure. The right answer is option C, decrease blood volume. Question number 9. In the type of immunity, vaccine is an example of ... immunity. Option A, artificial active. Option B, natural active. Option C, artificial passive. And option D, natural passive. इम्युनिटी दुई किसिमको हुन्छ, नेचुरल र आर्टिफिशियल। नेचुरलमा पनि दुई किसिमको हुन्छ र आर्टिफिशियलमा पनि दुई किसिमको हुन्छ। नेचुरलमा प्यासिभ नेचुरल र एक्टिभ नेचुरल हुन्छ। जुन प्यासिभमा जुन मेटर्निटीबाट आउँछ हैन, आमाको दूधबाट अथवा प्लेसेन्टाबाट जुन इम्युनिटी गेन गर्छ बेबीले, त्यो भनेको प्यासिभ नेचुरल भयो। र एक्टिभ नेचुरल भनेको इन्फेक्सन थ्रु कुनै डिजिज लागेको छ, इन्फेक्सन लागेर त्यो थ्रु इम्युनिटी गेन गरेको छ भने चाहिँ एक्टिभ इन्फेक्सन हुन्छ। र आर्टिफिशियलमा प्यासिभ र एक्टिभ हुन्छ। प्यासिभमा जुन एन्टिबडी ट्रान्सफर गर्छ त्यसबाट हुन्छ र आर्टिफिशियलमा एक्टिभ आर्टिफिशियलमा जुन इम्युनिटीबाट हैन, कुनै भ्याक्सिन थ्रु बेबीले चाहिँ गेन गरेको छ इम्युनिटी भने त्यो आर्टिफिशियल हुन्छ। सो यहाँ के भनेको छ, भ्याक्सिन थ्रु। सो दैट मीन्स ऑप्शन A is right answer. Artificial active. Question number 10. For the prevention of INH isoniazid induced peripheral neuropathy, which one is given? Option A, retinol. Option B, niacin. Option C, folic acid. And option D, pyridoxine. आइसोनियाजाइड लाई INH भन्छ। यसको आन्सर हुन्छ ऑप्शन डी, pyridoxines. That means peripheral neuropathy is avoided and treated with daily pyridoxines administration along with isoniazid, that is INH. Question number 11. Factors in cervical cancer development. Expect. Option A, HIV infection. Option B, chlamydia infection. Option C, breast cancer. And option D, smoking. इसको आन्सर हुन्छ ऑप्शन सी, ब्रेस्ट कैंसर। क्वेश्चन नंबर 12. Withdrawal syndrome is seen in which of the following drugs? Option A, diazepam. Option B, morphine. Option C, alprazolam. And option D, all. The right answer is option D, all of the above. Question number 13. First long-term health plan was started from option A, 2000 AD, option B, 1990 AD, option C, 1979 AD, and option D, 1975 AD. The right answer is option D, 1975 AD. Question number 14. Which one of the following is true about functional nursing? Option A, concentrates on tasks and activities. Option B, emphasize use of a group collaboration. Option C, 1:1 nurse-patient ratio. And option D, provides continuous, coordinate, and comprehensive nursing services. Right answer is option A, concentrates on tasks and activities. Question number 15. The commonest causative organism in a corneal cancer is option A, streptococcus, option B, staphylococcus, option C, gonococcus, and option D, pneumococcal. The right answer is option D, pneumococcal. Question number 16. Congenital absence of one or both testes are known as option A, torsion, option B, anarchism, option C, testiculism, option D, cryptosis. Congenital absence of one or both testes is known as anarchism. Option B is right answers. यसलाई एनोर्सिया पनि भन्छ। Question number 17. Most common cause of death in cancer of cervix is option A, septicemia, option B, hemorrhage, option C, acute renal failure, option D, cachexia. The right answer is option C, acute renal failure. Question number 18. Easiest symptoms of menopause. Option A, spotting. Option B, hot flashes. Option C, osteoporosis. And option D, vaginal discharge. Right answer is option B, hot flashes. Question number 19. Which of the endocrinal conditions may be associated with the H mole? Option A, hypothyroidism is right answer. Question number 20. Anterior colporrhaphy is done for repairing of option A, rectocele, option B, cystocele, option C, both, and option C, none. यो सर्जरीको नाम छ कुनमा चाहिँ यो चाहिँ युज गर्छ सिस्टोसेलमा युज गर्छ अप्सन बी इज राइट आन्सर क्वेशन नम्बर 21 claustrophobia is option A fear of height option B fear of closed state option C fear of open state and option D fear of narrow path fear of closed space is known as claustrophobia option B is right answer fear of height is known as acrophobia fear of open state अथवा open space is agoraphobia and fear of narrow path is also known as claustrophobia तर यसमा चाहिँ मेन भनेको fear of closed space आउँछ यो दुईटै भनेको सेम हुन्छ तर मेन भनेको चाहिँ यो बी हुन्छ बिगमा चाहिँ टिक लगाउनु पर्छ Question number 22 Nepal Health Professional Council decided to implement Code of Ethics in option A 2051 option B 2061 option C 2071 and option D 2062 the right answer is option B 2061 question number 23 highest source of vitamin A is found in option A cod liver whale option B halibut liver whale option C sunflower whale and option D palm whale इसको right answer हुन्छ option B Question number 24. Salt concentrations of seawater is option A 1.5%, option B 2.5%, option C 3.5% and option D 4.5%. Right answer is option C 3.5%. Question number 25. World First International Hygiene Agency. Option A World Health Organization. Option B Pan American Sanitary Bureau. Option C UNICEF and option D none. Option B is right answer. Question number 26. Incubation period of measles is option A 6 to 14 days. Option B 7 to 18 days. Option C 7 to 14 days and option D 5 to 8 days. The incubation period of measles is 7 to 14 days. Option C is right answer. Question number 27. Rollback malaria RBM was launched by WHO in option A 1997-80, option B 1996-80, option C 1896-80 and option D 1998-80. 1998-80 is right answer. Question number 28. Testes consist of option A 3 layers, option B 2 layers, option C 4 layers and option D 5 layers. Testes consist of 3 layers. Option A is right answer. That is tunica vasculosa, tunica albuginea and tunica vaginalis. Question number 29. Collagen affects option A conjunctiva, option B lacrimal gland, option C meibomian gland and option D eyelid. The right answer is option C. Question number 30. Blackness of tea and coffee is due to option A tannin, option B rannin, option C nicotine, option D taurine. Option A rannin is right answer. Question number 31. Which nursing action can best prevent infections from urinary retention catheter? Option A cleaning the perineum. Option B encouraging adequate fluids. Option C irrigating the catheters once daily. And option D cleaning around the meters routinely. Option D is right answer. Question number 32. Pathology report state that a client urinary calculus is composed of urine acid. What should the nurse instruct the client to avoid? Option A milk, option B liver, option C cheese, and option D vegetables. Uric acid बढेको छ भने चाहिँ एभोइड गर्नुपर्छ लिभर. Option B is right answer. Question number 33. A nurse is caring for a client who is HIV positive. For which complication associated with the diagnosis is it most important for the nurse to teach prevention strategies? Option A infection, option B depression, option C social isolations, and option D Kaposi sarcoma. Option A infection. Question number 34. A nurse is administering 40 mg of Lasix IV. Which sensations reported by the client does the nurse considers when determining what it is being administered too quickly? Option A bladder feels full. Option B ears are pulled up. Option C heart is beating fast. And option D left arm feeling numb. Ears are pulled off. Option B is right answer. Question number 35. A client with treatment of TB reports difficulty hearing. Which medications should the nurse consider is related to the response? Option A streptomycin. Option B pyrazinamide. Option C isoniazid. And option D ethambutol. Streptomycin. Option A is right answer. Question number 36. Client reports vomiting and diarrhea for 3 days. What clinical findings will most accurately indicate that the client has a fluid defect? Option A presence of dry skin. Option B loss of body weight. Option C decrease in BP. And option D altered general appearance. Loss of body weight. Option B is right answer. Question number 37. A nurse assesses a client's electrolyte levels in the laboratory report. What electrolyte in intracellular fluid should the nurse consider most important? Sodium, calcium, chloride, and potassium. Intracellular fluid is potassium. Option D is right answer. And extracellular fluid ma sodium आउँछ. Question number 38. A nurse is receiving the lab report of a client with a tentative diagnosis of the kidney failure. What mechanism does the nurse expect to be maintained when the anemia is excreted by the healthy kidney? Option A osmotic pressures of the blood. Option B acid-base balance of the body. Option C low bacterial levels in the urine. And option D normal RBC production. Option B acid-base balance of the body is right answer. Question number 39. For what chemical indicator should a nurse assess a client who is having a gastric lavage? Option A decreased serum pH. Option B increased serum bicarbonate level. Option C increased serum oxygen level. And option D decreased serum osmotic pressure. Option B is right answer. Increase serum bicarbonate level. Question number 40. A nurse is considered that a client is at a risk for developing hyperkalemia. Which disease does the client have diagnosed has caused this concern? Option A, Crohn's disease. Option B, Cushing. Option C, end-stage renal disease. And option D, GERD. End-stage renal disease is the right answer. Question number 41. Which clinical indicator should the nurse expect most from a client with the hyperkalemia to exhibit? Option A, tetany. Option D, dysrhythmias. Option C, diarrhea. And option D, both B and C. Option D is right answer, both B and C. Question number 42. A nurse adds 20 mEq of potassium chloride to the HIV solutions of a client with diabetic ketoacidosis. What is the primary purpose of administering this drug? Option A, treat hyperapnea. Option B, replace excessive losses. Option C, prevent flaccid paralysis. And option D, treat cardiac dysrhythmias. Replace excessive losses. Option B is right answer. Question number 43. Unattended blood gas reports indicate the client's pH is 7.25, PCO is 35 mm of Hg, and HCO is 20 MEq per. Which disturbance should the nurse identify on the basis of this result? Option A, metabolic acidosis. Option B, metabolic alkalosis. Option C, respiratory acidosis. And option D, respiratory alkalosis. Option A, metabolic acidosis. Question number 44. In which positions should the nurse place a client recovering from the general anesthesia? Option A, supine. Option B, side lying. Option C, high flower position. And option B, Tendelberg position. Supine position. Option A is right answer. Question number 45. What is the priority nursing interventions for a client during the immediate post-operative period? Option A, monitoring phase. Option B, maintaining a patient airway. Option C, observing for hemorrhage. And option D, recording IV chart. First मा चाहिँ airway check गर्नुपर्छ. Option B is right answer. Question number 46. A nurse in the PICU observed that after an abdominal cholecystectomy, a client has a serosanguineous drainage on the abdominal dressing. What is the best nursing action? Option A, change the dressing. Option B, reinforce the dressing. Option C, replace the trap with a Montgomery ties. Option D, support the incisions with an abdominal binder. Option B is right answer. Question number 47. For the days after abdominal surgery, a client has not passed a flatus and there are no bowel sound. Paralytic ileus is suspected. What does the nurse conclude is the most likely cause of the ileus? Option A, decreased blood supply. Option B, impaired neural functioning. Option C, perforations of the bowel wall. Option D, obstructions of the bowel lumen. Option B is right answer. Impaired neural functioning. Question number 48. The nurse is teaching a client about adequate hand hygiene. What components of the hand washing should the nurse include that is the most important for removing microorganisms? Option A, soap. Option B, time. Option C, water. And option D, friction. Option D, friction is the right answer. Question number 49. A nurse is performing to change a client's dressings. What is the reasons for using the surgical asepsis during procedures? Option A, keep the area free of microorganisms. Option B, conforms microorganisms to the surgical site. Option C, protects self from microorganisms in the wound. Option D, reduce the risk for growing opportunistic microorganisms. Keep the area free of microorganisms. Option A is right answer. Question number 50. A nurse in the surgical intensive care unit is caring for a client a large surgical incision. What medication does the nurse anticipate will be prescribed for the client? Option A, vitamin A. Option B, cyanobalamine, Mucovix. Option C, ascorbic acid. Option D, phytolodine. Option C is right answer. Sorry, यहाँ option C हुन्छ ascorbic acid, vitamin C. Type side mistake भएको छ typing. Question number 51. After recovering from a modified neck dissection from oropharyngeal cancer, the client receives external critical reactions to the radiation. Should the nurse assess the client? Option A, dry mouth. Option B, mucosal edema. Option C, skin reactions. And option D, bone marrow suppression. Option B is right answer. Question number 52. A homeless person is brought to the emergency department after prolonged exposure to the cold weather. What clinical manifestations of the hypothermia does not anticipate? Option A, stupor. Option C, increased anxiety. And option D, rapid respiration. Right answer is option A, stupor. Question number 53. A client with an inflamed sciatic nerve is to have the conventional transcutaneous electrical nerve stimulation (TENS) device applied to the painful nerve pathway. When opening the TENS, which nursing action is appropriate? Option A, maintaining the settings programmed by the healthcare provider. Option B, turn the machines on several times a day for 10 to 20 minutes. Option C, adjust the daily on the unit the client is set. Option D, apply the color-coded electrodes on the client where they are most comfortable. Option C is right answer. Question number 54. A nurse is caring for a client who has a paraplegia as a result of a spinal cord injury. Which rehabilitation plan will be most effective for this client? Option A, arrangement will be made by the client and the client's family. Option B, plan is formulated and implemented yearly in the client's care. Option C, the rehabilitation is minimal and short-term because the client will return to formal activities. And option D, arrangement will be made for long-term care because the client is no longer capable of self-care. इसको right answer हुन्छ option B. Question number 55. What is the basic concept associated with the rehabilitation that the nurse should consider formulating discharge plans for the client? Option A, rehabilitation needs are best met by the client's family and community response. Option B, rehabilitation is a spiety area, unique method for the meeting client's need. Option C, immediate rehabilitation needs are exhibited by the client with health problems. And option D, clients who are returning to their usual activities following hospitalization do not require rehabilitation. Immediate rehabilitation needs are exhibited by the clients with health problems. Option C is right answer. Question number 56. What is first actions a nurse should take before administering a tube feeding infant? Option A, irrigate the tube with water. Option B, slowly insert 10 ml of formula. Option C, offer pacifier to the infant. And option D, place the infant in downwards position. Option C, offer pacifier to the infant. Option C is right answer. Question number 57. A patient and 3-month-old infant are visiting the well baby clinics for a routine examination. What should the notes include in the ancient prevention teaching plan? Option A, remove small objects from the floor. Option B, cover the electric outlets with the safety plugs. Option C, remove toxic substance from the low area. And option D, test the temperatures of the water before bathing. Option D is right answer. Question number 58. A nurse is teaching a parent how to prevent accidents while caring for a 6-month-old infant. What ability should be emphasized about the infant's motor development? Option A, sits up. Option B, rolls over. Option C, crawls distance. And option D, stands while holding on the furniture. Option D, stands while holding on the furniture. That helps to prevent the infant from accident. Question number 59. A nurse is assessing the oral cavities of a 6-month-old infant. The parent asks which teeth will be erupting first. How the nurse should respond? Option A, incision. Option B, canine. Option C, upper molar. And option D, lower molar. First मा चाहिँ incision teeth erupt हुन्छ. Option is right answer. Question number 60. A nurse is performing a physical examinations on an infant with the Down syndrome. For what anomalies should the nurse assess the child? Option A, bulging fontanelles. Option B, shift lower extremities. Option C, abdominal heart sound. Option D, unusual papillary reactions. Abdominal heart sound is right answer. Question number 61. The nurse is teaching a group of about the side effects of the immunization vaccines. What signs should the nurse include when taking about the infant receiving the HIV? Right answer is option D. The side effect of immunization vaccine is low-grade fever. Question number 62. An infant is diagnosed with the communicating hydrocephalus. The parent asks for the classifications of the healthcare providers' explanations of their baby's problem. How the nurse should respond? Option A. Too much spinal fluid is produced within the spaces ventricles of the brain. Option B. The flow of spinal fluid through the brain cells does not empty effectively into the spinal cord. Option C. The spinal fluid is prevented from the adequate absorption by the blockage in the space ventricles of the brain. And option D. There is a part of the brain surface that usually absorbs spinal fluid. There is a part of the brain surface that usually absorbs spinal fluid after its production that is not functioning adequately is the right answer. Option D. Now comes to the question number 63. What does a nurse determine is most serious complications of the meningitis in the young children? Option A, epilepsy. Option B, blindness. Option C, peripheral circulatory collapse. And option D, communicating hydrocephalus. Peripheral circulatory collapse. Option C is right answer. Question number 64. A nurse is caring for an infant whose vomiting is intractable. For what complication is it most important for the nurse to assess? Option A, acidosis, alkalosis, hyperkalemia, and hypernatremia. Vomiting को केसमा alkalosis हुन्छ. Option B is right answer. Question number 65. A nurse is receiving the clinical records for the infants and the children with the cardiac disorders who developed heart failure. What is the nurse determined in the last signs of the heart failure? Option A, tachypnea. Option B, tachycardia. Option C, peripheral edema. And option D, periorbital edema. Option C, peripheral edema is the right answer. Question number 66. A nurse is administering IV fluid to dehydrated infants. What interventions is the most important at this time? Option A, containing the prescribed flow rate. Option B, monitoring the IV drop rate. Option C, calculating the total necessary intake. And option D, maintaining the fluid at body temperature. Containing the prescribed flow rate. Option A is right answer. Question number 67. A 5-month-old infant is brought to the pediatric clinic for a routine monthly examination. What assessment alerts the nurse to notify the healthcare provider? Option A, temperature of 99 degree Fahrenheit. Option B, BP 75 by 45 mm of Hg. Heart rate 100 beats per minute. And option D, respiratory rate 50 beats per minute. यसमा चाहिँ abnormal कुन दिएको छ? Respiratory rate 40 भन्दा कम हुनुपर्छ, तर यहाँ 40 दिएको छ. Option D is right answer. Question number 68. A nurse undergoes heart surgeries to repair the defect associated with the tetralogy of the fallow. What behavior is essential for the nurse to prevent post-operatively? Option A, crying. Option B, coughing. Option C, standing at stool. And option D, unnecessary movement. Option C, standing at stool is right answer. Question number 69. A school nurse is teaching parents of the school-age children about the importance of immunizations for the childhood communicable disease. What preventable disease may cause the complications of encephalitis? Option A, varicella. Option B, scarlet fever. Option C, poliomyelitis. And option D, whooping cough. Option A, varicella is right answer. Question number 70. A 3 years old child injects substance that may be a poison. The parent calls a neighbor who is a nurse and asks what to do. What should the nurse recommend the parent to do? Option A, administer syrup. Option B, call the poison control center. Option C, take the child to the emergency department. Option D, give the child bread dipped in milk to absorb the poison. Call the poison control center. Option B is right answer. Question number 71. Bradykinin and histamine are released during option A, tissue injury. Option B, dehydration. Option C, fluid and electrolyte imbalance. And option D, decrease ICR. ICP हुनुपर्ने यहाँ ICR भएको छ. Right answer is option A. Question number 72. The spinal cord ends at the level of option A, L second ventricle level. Option B, right ventricle. Option C, left ventricle. And option D, left atrium. The spinal cord ends at the level of L2. Option is right answer. Question number 73. The productions of the human requires the genetic process. Option A, mutation. Option B, mitosis. Option C, meiosis. And option D, inheritance. The right answer is option B, mitosis. Question number 74. Pediculosis corporis is a parasitic infection caused by option A, body louse. Option B, head louse. Option C, public louse. And option D, food louse. Right answer is option A, body louse. Question number 75. Incubation period for whooping cough is 7 to 14 days. Option B, 2 to 3 weeks. Option C, 1 month. And option D, 2 months. Right answer is option A, 7 to 14 days. Remaining question Set-20B मा include गर्नेछु. Thank you so much.